Hello, everyone. My name is Ross Firestone. I'm a fellow at Memorial Sloan Kettering Cancer Center. And at this conference, I'm presenting some work that I did using Teclistamab, which is one of our newer therapies for multiple myeloma. Teclistamab is a part of a new category of therapies called bispecific antibodies, which work by sort of redirecting the energy of someone's immune system towards killing their myeloma cells. Teclistamab specifically recognizes something on the myeloma cells called BCMA. And in the project that I worked on, I tried to see why a patient who was getting teclistamab might not do as well as someone else who has a really great response. And so we tried to figure out, is it something that's related to the myeloma cells themselves? Is it something that that BCMA target is responsible for? Or is it related to the patient's immune system? So what we did is we looked at a cohort of patients that were treated with teclistamab at our center, Memorial Sloan Kettering Cancer Center, and did a bunch of tests on their disease as well as their immune system to see if we could figure out why these patients weren't responding. The first thing that we looked at was to see if that BCMA target went away or became mutated, it became different in a way that made that teclistamab not work anymore. Because sometimes when people get treatments that go after BCMA, like a CAR T-cell therapy that they got before, it may change the way that that protein looks and make it harder for teclistamab to work. But we found that in our patient population, we didn't really see that that was happening so much. What we did see, though, is that there were certain ways in which the immune system could exist that wouldn't be as optimal for teclistamab to work. And that there were some patients whose immune systems were more able to use teclistamab than other patients. So what we're trying to do now is try to figure out a way to optimize the patient's immune system in the future so that when patients use teclistamab, they get a better outcome than they would otherwise. So you may be asking yourself, is this something that we can check ahead of time? Can we profile a patient's immune system to see if they would do well with teclistamab? And that's really what we're trying to figure out next. It may be that the immune profile of someone who's going to do really well with a bispecific antibody is different than the immune profile of someone who would do really well with a CAR T-cell therapy. And so because right now it's difficult for clinicians to choose between those two because they're both such great options, this is the type of thing that might help clinicians make that decision in the future.